This video examines federal government-sponsored healthcare policies in the United States. We're going to particularly focus in on Medicare, Medicaid, and Children's Health Insurance Program. First of all, Medicare was adopted as part of the Great Society programs in the 1960s under President Johnson, founded in 1965. The goal of Medicare is to help couple of groups of people. Typically, we think of it as being a program for senior citizens, people that are over the age of 65, that they can get their basic healthcare needs met. But there are a couple of other categories of people that are also eligible for Medicare that are not 65 or over. For example, the first larger category is people under the age of 65 with permanent disabilities, and also people who need dialysis or kidney transplants. So Medicare can get a bit complicated. There are actually 4 parts: A, B, C, and D. Really going to focus here on only A, B, and D. Program C is really kind of a private health insurance program that is run through private companies, a little bit different than everything else. Medicare Part A is what would be considered the standard part that you would get. This is the one that's taken out of payroll taxes. So all of your paychecks get a 2.9% payroll tax for Medicare. It comes out 1.45% from you and 1.45% from your employer. And this is as the core plan or core part of Medicare, pays for hospital stays and also for extended stays at nursing homes after the point in time in which you're released from hospitals. It's not completely free. Like most other health insurance, there are deductibles and co-payments as well. Medicare Part B is optional, but a fairly decent plan. As you can see when we get down here, it's a relatively inexpensive in relationship to private health insurance. About 95% of people that are eligible for Medicare Part A sign up for Medicare Part B. And this includes things that would typically be associated with healthcare that are above and beyond typical hospital stays. So going to see your doctor or outpatient services at a hospital, that sort of thing. And 75% of this is paid for by the government. Unlike Medicare Part A, which is part of the payroll tax system, Medicare Part B is funded from general revenue of the federal government. In other words, just the normal taxes, income taxes, and various other revenues that the government would get. And then the extra 25% is paid for by individuals who are part of the plan. As you can see here, it's typically not as expensive as private health insurance. So the premium for 2020 is actually $144.60 a month for most people in the United States. As you get a little bit higher up in income, those premiums will go up on a monthly level, but the standard premium is $144. You have basically a deductible of a little bit less than $200 a year, and once you reach that, individuals then pay about 20% of the costs of any type of services that they use, with the federal government picking up the remaining 80%. So, this historically pays about 2/3 of healthcare costs for the elderly. There are those plans, Medicare Part C, that you can get other additional supplemental Medigap plans. They're relatively expensive. The biggest addition really that we've probably had to government overall since the 1960s has been Medicare Part D, which was part of George W. Bush's compassionate conservatism, which provides, subsidizes at least prescription drugs for people that are on Medicare. That was not covered under previous plans that were out there. Some states have additional plans that provide better coverage for prescription drugs than does the federal government. And one of the things is, for a lot of people, this is very confusing because there are many different plans, and some plans cover the drugs that you're on, some don't. And it's become very confusing for many individuals. But that's the third major part. Now, just a quick look at where all this money is spent. So in 2017, $688 billion was spent on Medicare. And, a good chunk of that goes just towards the services provided by Part A and Part B. 21% go to hospital inpatient services while you're actually at the hospital. And you see that skilled nursing facilities are kind of those long-term health plans as well at about 4%. Now, here's the problem. Unlike Medicare Part A, we've got the payroll taxes, and then we've also got general revenue funding. But if you take a look at Medicare as an overall share of the federal budget is at 15% of the federal budget in 2018. So when we're thinking about this, Social Security is bigger, but Medicare is tied with non-defense discretionary defense. So throw in Medicaid, the Affordable Care Act, and Children's Health Insurance Program, and all of a sudden, what we're looking at is that it is at 26%, which was actually make health insurance or health provisions larger than any other category in the federal budget. The concern is that this is actually growing over time. So this is a look at about a 30-year period of the outlays, where we will go from about $605 billion in 2018 to double that amount by the year 2029 with almost 1.3 trillion with a T, $1.3 trillion in expenditures. And again, the best way to take a look at this is kind of relative to other time periods. That would mean that over the period of about 20 years, we would see that the overall expenditures on Medicare rose from about 3% of the economy or GDP to about 4.1%, and will grow from about 12.9% of the overall federal outlays up to about 18.3%. So reining in the cost of Medicare is a very important question that federal policymakers are dealing with. The second major program that we'd have also was founded under the Great Society programs of President Johnson, and also was established in 1965 as a revision to the Social Security Act. And this Medicaid program was designed to assist poor and disabled through a federal-state partnership program. So while Medicare is for older people, Medicaid can apply to just about any age group and focus predominantly on poor and disabled. So if we had a little bit more time, I'd break this down more, but there's only so much you can get into the weeds here. Essentially, this is a federal-state partnership where the federal government provides typically about half the cost of the program for Medicaid for poor people, and in poorer states actually provides more. And the federal government sets a floor of benefits that need to be provided and standards, and then individual states can provide more benefits if they want. And some states provide very limited coverage, whereby other states provide rather generous coverage. And unlike Medicare, which is this hodgepodge of a number of different programs, Medicaid's a little bit more generous and generally provides the kind of stuff that you'd see in a private health insurance situation. The one thing I want to add here is that Medicaid pays for about half of the nation's expenditures for long-term health care, and that would typically be what we would call nursing homes. And oftentimes those are people who are older who also have Medicare, but for financial reasons also qualify for Medicaid. And those long-term expenditures are paid by this program. Just want to take a quick look here at the number of people that are covered in the United States in different age categories by Medicaid. So if you are non-elderly, meaning that you're below 65 years of age and your income is below 100% of the federal poverty line, which is about $14,500, more than half of the people earning less than that, 55%, get their insurance through Medicaid. If you make up to twice the federal poverty line. So we're looking, depending on whether you have children or not, somewhere in the neighborhood of, $26,000, $27,000, about 40% there. 38%, and this is an amazing statistic, 38% of all children in the country are paid, get their health insurance through Medicaid, which is also part of the Children's Health Insurance Program that I'll talk about in a minute. Of those children who live below the federal poverty line, 3/4 of American children that live in poverty get their health care through Medicaid. And just a couple of other things about elderly people. So of those people that are Medicare beneficiaries, 20% of them also get their health care coverage. And here's what really kind of provides a lot of expense for the program. 62% of people that are nursing home residents, in other words, those people who are living in long-term care and need more care, medical care, are covered by Medicaid. Now, what's interesting here is that if we break it down and take a look at who's covered by Medicaid and who actually we spend the most money on, it's not surprising to see that people that are older and disabled take up a larger slice of the pie for Medicaid funding in the United States. This is the most recent numbers that I could find. So out of 80.6 million total enrollees and $463 billion in expenditures, we would see that children make up 43% of the total enrollment in Medicaid. Adults, 34%, disabled individuals, 14%, and people over the age of 65 would be 9%. However, what we see is that, it's not too out of the realm of possibility to understand why children would be less expensive. They generally tend to have less health problems. But what we see is that disabled people take up the plurality of the expenditures for Medicaid. While they're only 14% of the overall population getting Medicaid, they account for 40% of the expenditures. I was not able to find an updated chart on this, but my guess is that it probably hasn't really changed. What we see is that overall, there are a few individuals that are very sick. So 5%, the top 5% of people that Medicaid funding is spent on account for 47% of all the expenditures. So it really is the sickest Americans that are on Medicaid that require the most expenditures here. One of the things that people have been concerned about in recent years, particularly in Republican legislatures and Republican governors, has been the idea that we should require work requirements in order to be able to receive Medicaid. And the facts actually show that, about 2/3 of Americans that are receiving Medicaid already work, 44% full-time and 19% part-time. And the remainder of those people, for the most part, have some reason why they are not working, whether it's because of their own illness or disability, or maybe they're going back to school in an effort to be able to get re-educated for the job force, or they're giving care to some other individual. So the idea of putting work requirements in many respects wouldn't capture all that many people. What we do find is that for many individuals that are poor, they have less access to employer-sponsored healthcare coverage. So the people that are living at or below the federal poverty line, you can see here in the dark blue, navy blue, in many cases among all workers in that category, only 19% are eligible. Whereby when you take a look at people making, let's say, about $50,000 a year, about 56% of them are eligible. So you're much more likely to have working poor people be on Medicaid than you would have if you were making a larger salary. And this is kind of an interesting breakdown of some of the people that are most likely to be able to get Medicaid while they're working. by occupation. So, we've seen some statistics about Walmart having a considerable amount of employees getting food stamps and Medicaid. We see that people in kind of lower skilled occupations tend to be those who are the working poor that get their health care coverage through Medicaid. Cashiers, people typically in nursing homes that provide unskilled help are very likely to receive it. People in retail, personal care, cooks, people in restaurant business and that kind of stuff. So there are a lot of people that actually work and qualify for Medicaid at the same time. The final program we'll take a look here is the State Children's Health Insurance Program. This has been swallowed up a bit by Medicaid expansion, but this was part of the Balanced Budget Act of 1997, and this was set up to help people that were just above children that are just above the poverty line that didn't qualify for other programs, help them to get health care for themselves, not necessarily for their families. So this was a very big program of importance for the federal government and the states, again, a cooperative program. So this is just an overview of what we see in taking a look at the federal government programs. There's certainly many more, but these are the largest programs that the federal government deals with.